Thank you for joining us for this practice update. I'm Dr. Farzana Hafazullah. Joining me today is Dr. Robert Coleman. Dr. Coleman is an emeritus professor of medical oncology at the University of Sheffield. So great to have you back.
Nice to be here. Thank you.
So you've done some extraordinary work with Elsevier's Journal of Bone Oncology, and I really wanted to focus on that a minute. You and your fellow editor-in-chief, Dr. Payman Haji, you both founded Elsevier's Journal of Bone Oncology in 2012. That's tremendous and quite amazing. Can you tell us what led to this and why do you think it's important?
Well, bone oncology and cancer-induced bone diseases has been a research interest of mine and Dr. Haji's for many, many years. And we came to the conclusion that there needed to be a venue for our research findings and a dedicated journal for what we call bone oncology, which essentially is any effect that the cancer has on bone or the cancer treatment has on bone. And so we stepped out in faith that we could launch a journal and people would send their material and we'd be able to create a journal that would develop and grow and be successful.
Fantastic.
We called in a lot of favors
and
invited our colleagues and friends to send in their material, and little by little it's got established.
Excellent. And in 2015, the journal moved to open access. Please discuss the importance of open access research for our viewership.
Yeah, I mean, open access means what it says. It means that anybody who wants to read the material can, and I think this is very important for people outside big institutions that might have subscriptions to the big publishers. So I think this is very important on a global scale that everybody can access material. It encourages, I think, more collaboration. So we're very happy to see it as an open access.
Excellent. We're so glad that that was done. And like you said, you are just encouraging access to data that's vital for improving patient outcomes. So what separates the Journal of Bone Oncology from other journals in this arena or others that cover the same subject area?
Well, I think what's unique about it is that it bridges bone disease and oncology. So there are plenty of bone journals and there are hundreds of oncology journals, but none of them sit in the middle. And this whole specialist area has come from the working together of oncologists with endocrine specialists and bone specialists. And we're a slightly different breed to your average oncologist, your average bone doctor, and the issues are different. And so we felt that there was a niche and a hole in the market for a journal that would address these topics. And it's not a small topic. I mean, many patients develop bone complications from their cancer. It's one of the commonest places for cancer to spread. We have drugs that specifically target bone problems, so drugs like the bisphosphonates and denosumab. And also many of our treatments can have adverse effects on bone health, induce osteoporosis and all the issues related to that. So it's a broad topic.
Absolutely, yes.
And then of course sometimes cancer starts in bone, so you have primary bone tumors. So we kind of think there's plenty to go with. Absolutely.
So for our viewers looking at this segment now, what types of submissions are you looking for? Any specific topics that you wanted to go over? Give an overarching detailed definitions of what you're looking for.
Well, we have a pretty broad scope. So it's both clinical and laboratory research, and it's both metastatic cancer affecting bone as well as primary tumors. We publish original laboratory research, but we also like to publish clinical guidelines. We've published some this year from multiple societies on the treatment of aromatase inhibitor bone loss. We're interested in imaging of bone, surgery to bone, as long as it's related to cancer.
Of course. We're calling all specialists who can give a submission to the Journal of Bone Oncology. Please look online and access your information, and then submission process is outlined in that sense, or is there something else you'd like to outline for our viewership?
Well, we'd be delighted to receive manuscripts that fit with the scope. That's obviously online, and we're able to turn around manuscripts pretty quickly in terms of reviewing. Obviously they go for peer review, but we do that as efficiently as we can. And once accepted, manuscripts are published immediately. So it's a relatively rapid way for people to get their material out into the research community.
Great incentive. So please look online and make sure that you do check out the Journal of Bone Oncology. What is your overall vision for this journal? Where do you see this going in the next few years? And tell us topics that you feel are important to cover.
Well, we want it to be more widely read,
Yes.
and the manuscripts more frequently cited, and
Sure.
get a better impact factor. So we have an impact factor, but
Yes.
we want that to go up.
course.
We're aiming to get into that sort of, at least that middle range of journals within the next 2 or 3 years. Personally, I'd like to see more clinical material coming in, and I think we're very well served by laboratory research at the moment, but I'd like to see more clinical submissions,
Sure.
more submissions around imaging of bone, and but we will consider almost anything that's relevant.
Fantastic. Well, congratulations to you and Dr. Haji on a job well done, and
Thank
we
you.
are happy to continue to support your efforts.
Thank you for that.
And to our viewers, thank you again for joining us for this practice update. Please join us again soon. I'm Dr. Farzana Hafizullah.